Chapter 33, Etiology of Infection of the Upper Urinary Tract. The upper urinary tract consists of the kidneys and their ureters, the bladder, and the posterior urethra. The cutoff muscle separates the upper from the lower tract. The former is inside the body, as it were, and in its normal state entirely aseptic. The lower urinary tract, i.e. the anterior urethra of the male, the whole urethra of the female, is in no way separated from the integument and may contain the bacteria that flourish upon the surrounding parts. The flora of the anterior urethra have already been described in Chapter 16. Apart from prostatitis, the special characteristics of which have already been considered, page 163, the infections of the upper urinary tract are 1. Inflammation of the bladder, cystitis, pericystitis. 2. Inflammation of the kidney, its pelvis, and the ureter, acute renal infection, pyelonephritis, infected hydronephrosis, pyonephrosis, perinephritis. 3. Certain unusual types of inflammation, incrustation, malakoplakia, leukoplakia, cystitis, and pyelitis cystica and granulosa. Inasmuch as the upper urinary tract is aseptic when in its normal condition, the 3 prime questions to be answered in regard to inflammations are: 1. What are the bacteria of urinary infection? 2. How do they obtain access to the urinary tract? 3. Why do these bacteria sometimes cause infection and sometimes not?